Hey, good morning. I am good. Thank you so much for taking the time to meet with us and chat a little bit. Really good to see you. We're so excited. Yeah. Yeah, so we put out a poster this morning and a lot of people were excited to hear us chat a little bit. I will introduce you briefly and then you can fill in the gap. This is Dr. Brandon Schwintz, a board certified pediatric dentist who has been at Kona Kids Dentistry for the last 19 years, taking care of kids' teeth. He has a lot of other qualifications that I'll let him fill in the gap for, but I was really excited to bring you on today to talk to our followers out there about taking care of kids' teeth, preventing dental decay, and maybe the role of fluoride in that. So
super. Thank you, Dr. Palmer. This is my first Instagram Live, so thank you for inviting me. I'm super excited. I guess one thing I want to talk about today is just kind of the role that kind of cavities play in kids' lives and how we can obviously reduce the exposure to cavities, but also kind of the process that kind of modern dentistry kind of approaches things. And so it's okay with you, I'll kind of dive right in. And please.
Yes. Can I interrupt you for 1 second? So I'll tell you, my hidden agenda is this, that we here at Pure J Pediatrics, we're new to the area. We're literally across the street from you. So we're neighbors, but I'm not super familiar with which areas are fluoridated. So if you could just maybe give us the rundown, but after you kind of get into the meat of it.
So as far as fluoride in the water, Oregon is the second to the bottom of least fluoridated states in the country, right behind Hawaii. So just so you know. And so I have an interesting perspective in the fact that our offices across streets from each other, we're in Tigard that does not have fluoride, but Beaverton does. And so we get to see kind of a day-to-day cross-section of folks who have been exposed to fluoridated water and see the less cavities that on a day-to-day basis versus the ones who are not. If you grew up in the country like I did, there's no fluoride in the groundwater. And so typically a quick rundown of the list. Beaverton's the closest one, and Hills, I always have to ask my staff because I always get it mixed up, but Kaiser down in Salem, Troutdale out east, and Forest Grove. So that's kind of it. Everything else from, even though Tualatin Valley is part of Beaverton, that if you live in Tualatin Valley and have a Tualatin Valley water source, unless it says on your water bill that you have fluoride in the water, you don't. So it's really confusing. The city lines don't always match up with the water district lines and that kind of stuff. And so it's something to kind of look out for that way. It's a tremendous benefit for those who live in the fluoridated area, because you just kind of you cook with it. You don't have to drink a whole lot of water necessarily, but there's a dramatic decrease in cavities rate. So and so everywhere else is kind of not fluoridated. So and so with that, we kind of take all the factors that go into fluoride and into someone's cavity risk, and that's just one small part. The right off the bat that since I started practicing years ago, it was pretty routine for kids and babies to drink juice out of bottles. And in the last 10 years, I've seen a dramatic decrease in that, with fortunately a dramatic decrease in cavity rate, I think, with that. So there's a lot of tools at our disposal aside from fluoride, but fluoride is kind of a big part of that. And when someone comes to me for their first dental visit, the recommendations around age 1 or 2 years of age, a lot of the questions is like, well, gosh, they only have 6 teeth or 5 teeth. What you can't do fillings at this age, kind of thing, which hopefully we're not. But reality is we catch things early enough to avoid the process of cavity starting. And with that, we see a dramatic decrease in cavity rate. That said, in Oregon, 50% of all kindergartners have a cavity before the first day of school. So it's a pretty high rate. And so if it's something we can do, just little routine habits early on make a really, really big difference. So I could talk for hours about this, so please keep me on track though. But
yeah, I didn't realize it was that high. 50% of kindergartners have one cavity. And I just was going to add, so when my son was born, we were in Miami, and I didn't realize it. We were on well water, and there was no fluoride in the well water. And as a parent, when I brought him here to Oregon, the pediatric dentist took a look in there and found like 2 early cavities, and I was mortified because here I am, a pediatrician, and I felt like we've been brushing, we've been trying to like really kind of stress, the oral hygiene for a long time because I know the reason for it. But, my pediatrician didn't ask if we had fluoride in the water, and it didn't occur to me. So I probably am not 100%, but I do try to ask my patients about whether or not the water is fluoridated. But I guess maybe we need a better campaign for it to get those kindergartners to start without having cavities.
It's a big challenge because it's not like everyone gets equal amount either. 80% of cavities in children are in 20% of the kids. So it's pretty clumped together. And so kind of identifying who's at risk and who is not, we can kind of essentially make a prevention plan early. And some research has recently come out about the microbiome of our mouths. We all hear about the microbiome of our guts, but our gut flora. But we found that if anyone who's is caregiving for the child, whether that's the mom, a dad, or a grandparent, as those first couple teeth erupt for the baby, if the person caring for them has any active decay, that dramatically increases the risk of cavity forming for that child. So that means your babysitter, that means grandparents, that means, you're not going to look in the daycare folks, but usually when they do a genetic testing of the biome, it's usually the primary caregiver, particularly the mom, in most cases, I think. And so it's just something that we recommend both prenatally as well as ideally before the first tooth comes in, to get your own checkups, as parents. And the good news is, and the hard thing is that guilt is not an effective tool, right? That doesn't really help at all. So the good news is active decay, there's no association. So if I, as a parent, have had my teeth fixed, or even there's temporaries in or whatnot, there's no risk to my toddler that way. So, and there's a lot of tools at our disposal, but that's just one of them.
So I do remember reading that there was an increased risk for cavities for babies and for children. And I wondered if you could maybe elaborate a little bit about what we think might be causing that. Because I will occasionally see parents maybe put the child's pacifier in their mouth to clean it. Or do you think it's just casual contact, like kissing the baby, or what do they think is causing that increased risk for babies?
I don't know of any studies about specific kind of timing for that, but typically the cleaning off the pacifier is a certain one. Babies put, you've probably noticed this, babies put their own hands in parents' mouths all the time. So that happens all the time. And then, you as we're feeding our kids in the high chair, you take a bite, they take a bite, all that kind of stuff. And there's some xylitol gum that we'll prescribe for parents if there's any active they have active cavities while they get rid of it. If they themselves chew this gum, it reduces the bacterial shedding and the transmittance of that bacteria to the child that way while things get kind of cleaned up. So
Oh, that's great. So eat xylitol gum.
Kind of, yes.
Gum while you're
if you have any
baby.
active decay, yes. Any active cavities that need to be fixed, so it's one of those things.
Okay.
Yeah, and really it's about so cavities we always think about cavities as being big holes, and they're always kind of diagnosed all of a sudden. But in reality, every time we eat a Ritz cracker or any kind of carbohydrate, that our pH goes up in the mouth. And so snacking, particularly in the kind of the late toddler years or preschool years, can be a big component to that. But also there's the shape of the teeth. If there's really deep crevices and bumps in the teeth, that makes it easier for food to stick. And so there's a lot of times when it's literally, I mentioned this in my own office, this is no one's fault. This is just bad luck. Even the world's best brusher is not going to brush this one spot that way. Because we've all, at least I was raised that essentially cavities came from eating too much candy or not brushing. And so we think, you you got 4 cavities, you must be really bad about
Right.
brushing, kind of thing. In reality, that's just not the case. So yeah, that makes sense.
Yeah. Yeah, no, I think that's actually really important because as a parent, that's kind of how I felt. I was like, oh goodness, he has 2 cavities. I missed the boat. We didn't do the fluoride because we were in well water, didn't even think about it. And then, like I said, I was mortified. And, it brings me to, I think a lot of parents out there just kind of think, well, they're the first teeth, they're going to fall out
Right.
anyway. Like, why do we care about preventing cavities? Why do we even care about treating cavities? And I just wondered if maybe you could comment a little bit on that, because I know what I tell parents, but honestly, I'd love to hear what you say, because you're educating me
Certainly
as
happy
well
to
as
kind
our
of give you my
followers
own
out
kind of
there.
take on things. And a common question, particularly as kids get a little bit older, is these are, quote, just baby teeth, right? And you're going to get a replacement. It's one of the few body parts
Right.
that kind of like regrow itself. And why spend all this effort and expense to fix them? And essentially, that anytime you talk about cavities on baby teeth, it's essentially a race between how fast that cavity is going to grow and get into the nerve of the tooth and cause pain, because every baby tooth has a nerve, just like our grown-up teeth do, so they feel pain just like our grown-up teeth do. And then how fast that grown-up tooth is going to push it out. So for a lot of kids, like even as early as age 4, 4.5, girls start losing their bottom front teeth. And so if there's a cavity there at around that age, we typically recommend just scrub and brush all the other ones extra hard and expect them to come out. But if it's a back molar, that doesn't fall out till typically 11, and the race essentially is going to go to the cavity, and it's going to cause a toothache. And so the question is the cavity at this stage small and easy filling to do? Oftentimes we'll just say, it's so small right now and the child's so young, let's wait even 6 months or even a year while the child gets a little older, goes to school, and we can treat this in a more comfortable manner. So it's not always a binary on or off, fix it, don't fix it right away.
Right. Which leads to how important it is actually to have like regular dental checkups for kids, because their teeth are growing. They're, in different stages of eruption, different stages of teeth falling out. And it really kind of it sounds like a little bit of a judgment call on the part of the pediatric dentist, is taking a look in there and sort of evaluating how old is the child? Is this tooth likely to fall out soon? Or is this one of those back teeth that actually needs to be treated sooner rather than later? That's fascinating. I hadn't even thought about that. I just kind of thought, well, every cavity should get treated if there is one.
Unfortunately, our options are much greater than they were even 5 or 10 years ago. So if a child, say, for instance, really young, 2 or 3 years old, and on a tooth that's potentially could cause a toothache, instead of saying, oh, automatic, if there's a cavity, you have to do a filling, there's a material we call silver diamine fluoride, or SDF, and it's a clear liquid. It's done as a stopgap measure. So instead of actually drilling on a tooth and putting a filling, typically white filling in, we rub this material on the tooth. It oxidizes the bacteria and remineralizes or strengthens the enamel, and essentially stops the cavity with the medical perspective rather than a surgical one. So it does cause a stain on the tooth, and that's something that we kind of go over in terms of the ups and downs, so the benefits and the downsides of every procedure, and that's certainly part of it. But it's a routine thing we do just to give an option of not necessarily doing, numbing the tooth up and doing fillings and stuff. So.
Right. Well, that's a great option. So, okay, so what happens to the child that maybe does finally have a cavity that needs to be treated? Like, what would you do? What would you do in the office for those children? And I ask this actually because some of my patients see you, and some of them are the sort of children that don't like to hold still very well, and maybe don't even like to brush their teeth. So I just kind of wondered, like, what's your approach to those children that have a hard time holding still, which would probably be most of them.
Fortunately, because of seeing kids so young, that a lot of them have gotten used to coming to the dentist, and they've had a lot of good experiences. So we'll routinely treat 4 and 5-year-olds all the time, wide awake, watching TV as we do the fillings, without necessarily more medical options. But for the majority of kids, so I get referred kids from the coast and up and down I-5 who have a lot of cavities and don't have the ability to sit still. And just like if someone really needed ear tubes and needed to have those placed, no one tries to hold still to get those placed. You have under general anesthesia. So we utilize, for a little bit older kids, oral sedation, where we have kids drink medicine, oral Versed, here in the office, and that gives them enough
Okay.
of a calmness to be able to endure the Novocaine. But for a lot of kids, there's just so much work and they're so anxious or inability to hold still, particularly special needs, that we bring an anesthesiologist in and then they fall asleep and we fix everything. And so that way, from their
Okay.
perspective, from the child's perspective, their eyelids closed, the eyelids open, and it's all fixed. There's no hearing a drill or feeling injections in their mouth. Exactly.
No anxiety whatsoever. Yeah, that's good to know because I think, like I said, my son had a little cavity and he ended up having to have that fixed. And he, they did the nitrous with him and he was okay with that at first time. But after that, he said he didn't want the stinky
Right.
medicine anymore. And so I was like, okay, well, and now we know better.
Hey,
And
good.
now we're in Washington County where there's fluoride in the water. And so we didn't have another cavity, but I was like, oh boy,
Yeah.
let's not get another one of those cavities. I wanted to ask you, so what I tell my parents is that, yes, you want to take care of those teeth early on. As soon as those first teeth come up, you want to start practicing brushing just so that your child is kind of used to having you manipulating something in their mouth. And then, definitely go start seeing the dentist at about a year of age so that they get used to, going to the dentist. And it's funny because I do have patients that go to family dentists, but I really like to steer my patients in the direction of a pediatric dentist because I'm like, they get kids, they make it fun. If the experience is fun and very like kid friendly, then it seems a little less intimidating for kids. And then they just kind of get used to going in there and having their teeth counted.
That's right.
Which is what I call
Well,
it. Let's just let them count your teeth. Yeah, and then I will usually tell them the dentist will probably apply some fluoride varnish. And how effective is that fluoride varnish at preventing those
show
cavities?
that it takes a child down from wherever risk level they're at down to 30% less chance of a cavity. And that's done twice a year. Now, for kids who are higher risk, so for instance, kids who are on asthma medications that dry the mouth out, or they are, and my recommendation is for things like that, whatever the doctor says, do that. We can always fix the teeth. But constipation situations where there's a lot of necessity to drink lots of, say, prune juice and things, that increases their risk. And so we need to balance out like maybe more frequent fluoride visits for those children or more frequent cleanings or just making sure that the parents know exactly where to brush, that kind of thing, and what foods are really helpful. For instance, snacks of cheese has been shown to reduce cavity risk. So like little pieces of, string cheese or cheddar cheese, it's all the same. And that's kind of helps balance out the pH. So just kind of a person to person, kind of a plan to keep cavities away.
Oh, that is really fascinating. I didn't even think about that. I did start putting fluoride varnish on my patients' teeth, and what I'll usually ask is, when was the last time you saw the dentist, and when are you going to see them next? And if I'm seeing them kind of between dental visits, then I'll go ahead and put the fluoride varnish on there. I didn't even think about asthma medications or constipation and the increased consumption of juice. Oh my goodness, these are great kernels of wisdom.
Again, I want to make sure that my pediatrician friends are getting the treatment there, make sure the treatment's being followed by you guys. But from a tooth perspective, the effect on the teeth, for instance, for constipation scenarios, if they need to drink lots of prune juice or juice and pear juice or whatnot, to drink it quickly, to drink it in one sitting, rather than having 4 sips or 4 cups or whatever throughout the day, can make a big difference in terms of the risk of the cavities. So it's just little things like that can just kind of help blunt any effects.
Right. Well, and that actually kind of leads to one of the reasons why we discourage bottle drinking, is because there is a correlation with babies that drink from bottles, and it kind of, they kind of sip on it and then they'll hold it and sip it again. And so their teeth are really constantly being exposed for a longer period of time to whatever's in the bottle. I usually recommend just water or milk for my patients. I don't think I have too many drinking juice, but if it's juice, maybe brush their teeth afterwards. Yeah, so you're talking about risk reduction. Like if you do need to drink the juice, drink it quickly. But that's actually a really good point, because I do sometimes have patients who are constipated, and I'll recommend that they do Miralax, and it mixes really nicely in orange juice, but orange juice has also got a lot of sugar in it. It's very sweet. So that's actually a really, really good point.
Yeah.
Wow. Yeah. So many hidden things that actually increase your risk for cavities that, gosh, I feel like I should probably put together a list of like increased risk if this, increased risk if this, come and, go in and see your pediatric dentist, or come in and see us for, an interval visit. Do you have patients that just come in to get fluoride varnish?
Great question.
Between doctors,
I have
dental visits?
Pretty much routinely for the kids who have to say go under anesthesia for treatment, that they're automatically in the high risk category, and there's a lot of motivation, of course, to not get another cavity for those kids, and also because there's a higher chance if you've had a handful of cavities as a young child, you're more likely statistically to have cavities later. So coming in for more frequent visits for just the fluoride application, the fluoride varnish, also desensitizes you to the environment a little bit, because it's a really easy visit, get a prize, and go home. And so it just kind of makes things a little bit easier for kids. So yeah, that makes up to 4 times a year really helps. Some studies are showing 6. Yeah.
Okay. That's awesome. Oh yes, please tell my followers what kinds of goodies they get when they come to the dental office, because I try to tell them, but I haven't been a patient of yours, so I'm not quite sure how you guys do it. But it's such an important thing for kids. They come in here going, "Do I get a lollipop?" I'm like, "No, you get stickers, because that's not lollipops."
So going to the dentist, knowing you have to get some things done, we try to keep it fun for various age groups, and so younger kids do get stickers. That's a big part for what we do as well. But we have a little prize machine where they get bouncy balls if they're over 3, and other little toys they can choose from. And once they get to be in 3rd grade, we have a kind of next level of prizes where there's little stretchy guys and frisbees and all kinds of stuff. So I want, and there's a clinical reason for this. Most people who are my age who are afraid of the dentist usually have to have 50% of it had an early experience in childhood where that caused that negative experience. So just trying to build positivity that way. So.
Yeah, no, I think that's actually really, really important. I had a great pediatric dentist, and he had some techniques that I didn't even know, like he was, putting Novocaine in when I had a cavity. But I had such a great experience. And then as I got older as an adult, I was like, why are people so afraid of the dentist? And, the thing is, like, once your adult teeth come in, those are the teeth that have to last until you're 90, or however old you're going to get. And a little tiny cavity, sometimes the filling needs to be replaced later on, and then part of your tooth starts to like disappear, and then so it's kind of a downward spiral. So bottom line is, take care of your teeth early. Get in to see the pediatric dentist with your children at 12 months and up. Do you have kids come in with their older siblings too, just to kind of desensitize them to the pediatric
because if they see their sibling, older brother or sister getting a cleaning or something, and then they're like, "Oh, I can do that." And younger ones can be so brave when they see their they want to do. They want to get in the big chair. They want to get a prize. They want to see. Absolutely. So
just like Big Brother.
Add that to our advantage. And so it's always amazing to see this little person hop on up because they saw their older brother do it. So it's pretty great. Yeah.
That's great. Well, can you think of any, like, I could pick your brain about dentistry things in kids all day, because honestly, in medical school, whether we end up being doctors that take care of adults or children, we really don't get very much on dentistry at all, and not even really in residency training. I think the exposures I had to pediatric dentistry were like kids that were admitted to the hospital with for IV antibiotics for dental abscesses, and I was like, wow, I didn't know that was possible. And then having children admitted for general anesthesia because they had so many cavities, especially children with special needs. And so that was really the exposure that I got. I would say most of what I've learned is because I've gone to conferences and like chosen to learn more about like pediatric oral health, which we're really kind of pushing hard to help kids keep their teeth healthy. The interesting thing that I do tell kids in the office is that it's so interesting, like the things that are not good for your body are also not really good for your teeth, right? So eating a lot of candies just isn't great for your body, doesn't give you good nutrition, and then it exposes your teeth to things that would cause more cavities. But if you could think of like one thing to kind of leave our followers with to help prevent dental cavities, what would that be?
I give 2 answers. So for the young, okay,
you can give 2.
That for the under preschool age range, with the exception of if your doctor says to do it, we should treat juice like candy. It's kind of the same thing, and that would be like special occasions, out to dinner. That'd be great. And for the kids who are
Okay.
kindergarten and up, floss seems really boring, but it's the kids who get used to flossing in elementary school usually have a super easy time at the dentist all through middle school and high school. And the opposite is true as well. So it seems like it's a one-off thing, but it makes a huge, huge
Okay.
difference. And if I could find out a way to make flossing exciting, I would retire tomorrow. But that's
That was going to be my next question, actually. I was like, for sure, Dr. Brandon's got a trick up his
yeah,
sleeve about like how
yeah.
to make that fun.
Back to
But
the drawing board,
okay,
unfortunately.
well,
So
back to
still
the
working on
drawing
that.
board.
So
Okay. Well, I'm going to open up for questions. We have a couple viewers out there. If anybody has questions, just post them in the comment section. In the meantime, how can people out there find you in Kona Kids?
we
Where
are on
do
the
you guys
corner
hang
of
out?
Durham Road and Summerfield, which is kind of right across the street from Trader Joe's. If anyone knows where Trader Joe's is at in Tigard. We're at konakids.com. And if you have a question about teeth or about potential coming to the dentist, we have a little questions and answer little button you can push on there. And you can also reach out to me via our Instagram here. So, yep.
Awesome. Yeah, no, I saw you on Instagram when we moved in and somebody posted about Trader Joe's. I was like, oh, that's right, Kona Kids right across the street. So it's really fun to be your neighbor. Thank you so much for taking care of my patients as well as you do. They absolutely love you. It's so fun because I'm always asking, like, who's your dentist? And like,
That's
Kona Kids.
great.
I'm like, oh, across the street. So so fun to have you on an Instagram live together. And I think that we have plenty of things to ask you about in the future. So we'll definitely
Can't wait.
have
Thank
to
you
get
so
together
much.
and chat again.
Take care.
Yeah,
Today.
it was good to
Bye.
see you. Take care. Thank you so much.